Welcome back to the Habit-Based Lifestyle Podcast. I'm your host, Jesse Ewell. Today, we have a very special guest, Dr. Cole Miller.
How's it
He
going?
is doing good, man. He is from Sioux City, Iowa, and he's one of our VIP weight loss practitioners. He's a chiropractor. Cole, I want to welcome you on the show today.
Hey, thanks for having me, Jesse. Appreciate it.
Hey, man, tell me a little bit about like how long you've been a chiropractor and what got you started in the chiropractic industry.
So, I've been a chiropractor for almost 6 years now, and I started as a VIP weight loss system coach. I've been doing this for about 6 months now. So,
Okay.
kind of around this time last year, I really started to kind of dial in my own nutrition. Because I've been dealing with, I was on high blood pressure medication for 10 plus years, high cholesterol medication for 10 plus years. And I was having some pretty crazy episodes, like hypertensive episodes, like chest pain, trouble breathing, stuff like that. And I was just kind of sick and tired of that. So,
Okay.
I'm going to cut out all the bad stuff and, start to, dial in my nutrition and my exercise and sleep, hydration, all that stuff.
What would you say? What would you say the number one thing is that you that kind of made you recognize that you needed to change something?
When I would wake up with low energy every day and just feel like crap, not motivated at work, not motivated at my workouts.
Okay. So you were still working out and
Yep.
doing some of those things. So what, in doing that, I mean, just as a chiropractor, what was kind of the deciding factor that's like, dude, I got to change something?
When I had this, at the time I thought it was a heart attack,
Okay.
but it ended up just being like a severe acid reflux flare-up.
Okay.
Right in the middle of my chest. And, they had me on a heart monitor and, I was doing all these labs and tests and I'm like, I've had it, man. That's when I cut back on alcohol. I cut out nicotine. And, after about a month of changing my lifestyle habits and, really dialing everything in, I got off my blood pressure medication that I was on for 10 plus years, and I got off the statin that I was on, for 10 plus years as well.
Wow. Okay. So you'd had high blood pressure for 10 years.
Yeah. Yep.
Or diagnosed with it.
Right. Yep.
Okay.
I've been on it since I was 20.
Wow. Okay. But you weren't, I mean, how much overweight would you say you were?
I'm 6'4". The highest I ever got was 220, so I wouldn't really say I was ever overweight. I was carrying a little extra, what we call it skinny fat.
Yeah.
A little extra tummy fat. But the doctors, they told me that it was genetic. You're going to be on these medications the rest of your life. And, at first I listened to them and I'm like, oh crap, this sucks. So, once I started to change my habits and I'm like, that I'm not going to be on these things anymore. So yeah.
Cool. So how long did it take you to get off of, medication and kind of get your acid reflux under control?
Right. It was probably 5 or 6 weeks.
Okay.
Kind of from the time from when I started really, focusing on my nutrition, eating whole foods, and, basically keeping track, of what I was putting in my body, about 5, 6 weeks.
Okay. Awesome, man. So you kind of go through your own personal transformation. You're working as a chiropractor in a clinic, and then around what time did you decide, hey, I think I actually, want to do some type of health or weight loss program?
Yeah, so I got into chiropractic thinking, and adjustments gonna fix everything, right? And we see it basically every day in practice. people that are chronically inflamed, in chronic, chronic pain, and they keep coming back every week, and they think some miracle change is going to happen. They're getting temporary relief from the adjustments, right? Adjustments are, critical in everybody's health, but
Right.
if we're carrying that extra 40 to 50 pounds, I see some people that are 100 pounds overweight, right? There's only so much a chiropractic adjustment can do. So, I started my own journey back in about January of 24. It was when I reached out to one of our co-creators, Dr. Nick. I think it was in March or April. And I kind of was getting some feelers out there to him. I'm like, hey, I had seen his Facebook posts,
Right.
about him. Like, hey, what's this weight loss system all about? I'm interested in, getting some nutritional stuff in my practice as well.
Right.
And ended up joining, I think it was in June or July, started with, VIP weight loss system
Yeah.
with you guys.
Awesome, man. So, being in and starting with the VIP weight loss system, you'd never really done anything like that before outside of your own thing. What, what was that transition kind of like? Because obviously you're going from just doing chiropractic to now, you're all of a sudden offering weight loss. Like, what was that like for you?
Right. At first it was kind of like, oh crap, I don't know what I'm doing,
Yeah.
It took time, of course, like everything does. It took me getting outside my comfort zone, because before I was kind of hesitant about talking to my clients, my patients about their weight.
Yeah.
So, it took some time for me to be comfortable with that, and communicate that to them, and ask them questions about, them kind of starting to, talk about their weight, and extra, belly fat that they've been holding on to.
Right.
So yeah, now, so that was 6, 7 months ago, and it's a whole different story now, and I feel very comfortable talking to them about it, and I'm glad I am.
That's awesome. So, let's talk about, because like obviously chiropractic, they're teaching you essentially how to be a chiropractor, but like, what are some skills that maybe you've learned just going through the VIP weight loss system, that like you've been able to learn and not only do that, but like help your clients with?
I'd say number one thing overall is communication.
Okay.
Being able to, kind of get into client and patients, emotions, and seeing kind of what they're dealing with, in their everyday life that they, may not, we may not have gotten into, a year ago, back when I'm like, okay, how's it going? How's your day? We'll get an adjustment, get out of here. So, communication's a big one. And then kind of, better understanding and seeing client and patient results, because I never really kept track of that before. A little bit here or there, on treatment cards and in our, soap notes, but I would say allowing clients to see the results that they're getting right in front of them.
Awesome. And then as far as like, I know we've chatted a few times just about like sales and marketing, stuff like that. Like those have been some big things for you kind of on the other side, right? That you've really learned, which you don't really learn in chiropractic school.
Oh, no.
But like, what has that helped you with, man?
Well, the marketing, just the being consistent and posting on social media, more people than I've ever imagined are coming up to me saying, "Hey, man, I saw your post. Looks like you're doing great with this VIP weight loss system." And I've really, I've had several people come up to me and say, just because of your basic engagement questions, I started to actually think about, what I'm putting in my body, and started to think about my health more. So, that marketing side of it, we don't learn any of that stuff in chiropractic school. So yeah, it's been a big, a good learning experience for me for sure.
Yeah, that's awesome, man. Give me like your top two reasons why, you think a chiropractor should put a program like this into their clinic.
Yeah, like I said, um, adjustments can only go so far, especially if, um, we're not addressing the patient's health metabolically, right? If they're holding on to that extra stubborn belly fat, a nutrition, sustainable nutrition plan, it's a game changer. It's been a game changer for my patients. I've seen some people that I just met, through, the Facebook marketing system that you have in place for us. When they go see their chiropractor, because I have a few patients, I live in Iowa. I have a few patients clients down in Arizona now,
Okay.
and they have their chiropractor down there. So, they're having to go see their chiropractor less, because they're having less pain because they're starting to address nutrition and anti-inflammatory foods into their diet.
That's awesome, man. So what has been, I know this month is kind of a record month for you, but like it's obviously been your best month, but like what is your best month doing this as far as revenue?
15K so far this month.
Okay.
So
Awesome.
we've got a few days left.
Yeah. So you're going to hit that 20K, right?
Yep. That's what we're going for.
That's awesome. So what do you see as like a possibility for you to do in terms of revenue with this model, in 2025?
I set my goal, at 10K per month, but as I've already seen, it's almost, doubled that. So, being able to do 15 to 20K every month, and adding an extra, 200,000.
Yeah, that'd be pretty sweet, right?
That would be a game changer for sure.
So what is the difference of like maybe this style of business versus maybe traditional chiropractic? Like, because like a lot of guys don't know, right? It's like it's a very different type of business. One's can be done 100% virtual, but like what has this really shown you in terms of what you're capable of doing?
Like you said, it's all virtual, right? So we can reach, I'm in Iowa. I can, get a client in, whatever state, that I want. So, and it kind of made me realize, I used to go to all these health fairs, and it's hard to say how much I got out of those. I maybe one or two leads or potential patients, but reaching thousands of people on Facebook just by pressing a button,
right?
It's so much easier to reach a bigger audience, and then they share it, and then their friends see it, and then their friends see it. I had a few people last week. I had a gal reach out to me on Facebook who I wasn't friends with her yet, and she said, "Hey, I'm so and so. I've been referred by so and so, this other gal, which I didn't know who she was either.
Right.
She must have seen my post from somebody sharing it. So, it's easy for posts to get out and, get around and people to share it. So it's easy to get a big, a bigger audience to see it as compared to doing, a few health fairs every month.
Right. No, that's awesome, man. So like the social media part has really helped you kind of expand your mindset on, maybe the traditional part for you with getting new clients was going out doing health talks. Now you can do essentially like a health talk or whatever you want every single day on social media.
Oh yeah, for sure. Yeah, I think I got through my Facebook post, I've probably gotten more new patients from Facebook, as chiropractic patients, not VIP patients, as opposed to, in the last 6 months as compared to, the 4.5 years of health fairs.
Wow. Okay.
So, yeah.
That's awesome, man. And, I think that the thing is a lot of people, traditionally chiropractors are focused way more on Facebook ads, doing health talks, things like that. Um, why do you think this method works so well for marketing? Like the social media part.
Um, it's all organic, right? It's on the the personal side of it as opposed to um, like the clinic page, right? There's some good things you can get out of posting off of a Facebook clinic page,
Yeah.
but there's also so much that you can do with those, and running ads through those, and paying however much money per month, running those Facebook ads. But this is all organic, um, all free advertising.
Got it. Awesome, man. Let me ask you this, just like with the nutrition plan, understanding like getting certified and like the coaching and accountability part, like what has been some of the biggest things you've learned with the nutrition system of VIP and then also the coaching and accountability system?
Yeah, I'd say the biggest thing with the nutrition plan that I've learned is, there's so many different fad diets out there, and most of those are so restrictive, right? To where you're cutting back on cutting back on carbs, the keto stuff, and people they get results when they're doing those things, but they're not real sustainable.
Right.
With the VIP program, we're addressing, speeding up metabolism from nourishing our body with, the proper foods, the good, and getting enough protein, getting enough good carbs, and balanced meals throughout the day,
Right.
so that even after they get done with the program, they can continue to lose weight even afterwards. Because with the other fad diets, a lot of people, I mean, I'd say just about every person that say they've been on a weight loss program in the past, they've gained weight after they've got off of it, which the
Got it.
VIP program is different, and people tend to continue to lose weight after they're done.
Cool. And what's maybe been an unexpected result for you being in the program?
Um, you mean like a result that a client has gotten?
No, like that you weren't expecting to get out of it.
I guess I wasn't like I've gone through the program myself. I wasn't expecting to gain as much muscle as what I did
Okay.
in the past year.
Awesome. That's great, man. So give me like one or two things you see from clients about like results of the program, because that's obviously a big part of, why you want to do this, right?
Yeah, yeah, for sure. Biggest thing I've seen is, people tell me that they just feel more energetic throughout the day.
Okay.
They're not only losing weight, but um, their their mind is, clearer, because they're, you know, putting the right things in their body, and kind of having that brain body connection, that their body's looking for. So their, mind, their thoughts are clear. Um, I've seen it so many times already here. People, their goals are to lose 25 to 30 pounds, and just in like the prep week, before they actually start the program, they lose anywhere between like 5 to 10 pounds in the first
Wow.
week.
Okay. Awesome, man. Yeah. I mean, that's amazing. Let me ask you this. You know, say a chiropractor, health professionals thinking about bringing this into, their clinic, their office, like, tell me like why, you think somebody should do this, or like somebody that may be on the edge of doing it. Tell me like why you think they should do this.
It's just, it can be an absolute game changer for, not only the provider, and getting, being financially stable from it, but getting better patient, better client outcomes, better results. Patients are happier, and it's just, it's really easy to add, into My everyday routine. It's been, there's definitely been, a few days where I'm like, dang, this is some hard work, but kind of once you kind of get your, feet wet and kind of get things figured out, there's not a whole lot of extra work, that goes into it besides, the 1 to 2 hours, that it takes to, to kind of get what you're looking for.
Right. No, that's awesome, man. Yeah, well, dude, like, number one, super proud of the work you've done and just having a record month. I know, you've been super committed to the process in the VIP weight loss system. So we're super excited to see what you're going to do in 2025. If you guys are looking to connect with, Cole, you can go to the show notes. You can even reach out to him on Facebook, ask him, how the VIP weight loss program is helping him. If you guys want to be part of our habit-based lifestyle community, you can also check out our Facebook group, Habit-Based Lifestyle and Business Secrets. If you want to find out more about the VIP weight loss system, you can go ahead and go to the show notes, or you can email me, Jesse@habitbasedlifestyle.com. Until next episode, have a great day.